New South Wales now has more than 300 cases of COVID-19 with 40 new infections recorded in the last day. The state's health department is urging anyone who attended a rugby function at Sydney University last Saturday to self-isolate, as they're now considered to have been in close contact with a confirmed case. The state's Chief Health Officer, Dr Kerry Chant, confirms 6 people are currently in intensive care.
So as at 11 a.m. today, we have 307 cases of confirmed COVID-19 infection. 129 of these were acquired overseas, and in recent weeks we've seen an increasing trend towards returning travellers from the UK, Europe and also US. 59 contacts of confirmed cases, and that reflects the importance of our public health measures about making sure that we self-isolate the cases and also quarantine the contacts. We have a further 70 cases under investigation and 46 cases where we believe local transmission has occurred. It's reassuring that many of our cases continue to be mild, with currently 6 patients in intensive care units. Many of our patients are being managed in the community and being managed at home, and we are only admitting patients now that require hospital care. Whereas in the beginning, as we became more familiar with the management of this disease, we took a precautionary approach in admitting them to hospital, despite the fact that many of them did have mild disease. We've had 5 deaths in New South Wales, and there are a couple of public health alerts that I'd like to put out now and get them disseminated to the community. So in relation there was an event between University of Sydney and University of Queensland rugby clubs, and it was held on the Sydney University football ground function room on Saturday the 14th of March, starting at 7:30 and finishing at 10:30 p.m. All people who attended this event are considered close contacts of a confirmed case, and we ask that any attendees immediately self-isolate themselves for 14 days. So that will be until midnight of Saturday the 28th of March. And should anyone develop symptoms, please contact the public health units on the appropriate numbers. There is guidance on our website in relation to what you need to do to self-isolate yourself, but please don't hesitate to contact us if you need further details. We will continue to make efforts to contact people directly, but we are making a public announcement in relation to the need to self-isolate.
The Victorian Government has announced an extra $437 million for the public hospital system to help deal with the coronavirus outbreak. The Premier, Daniel Andrews, says hospitals are preparing for record demand and the funding will go towards opening more beds.
Additional resources to deal with the inevitable peak in cases of COVID-19. The pressure that will bring to bear on our public hospital system will be enormous. It's important and appropriate to provide that additional funding now. For instance, Baxter House in Geelong, which had been a private hospital, that will be opened up as a COVID-19 clinic. There'll be beds, there'll be other walk-in, walk-out services there as well. The old Peter MacCallum Cancer Centre, the Ioneer occupying some part of that. There will be additional space opened up there for those patients who will need care at lots of different levels, but particularly intensive care, high care. And Bendigo Hospital, there's some shelf space there that will be commissioned and opened up to again provide support to those who will need healthcare at a critical time. This is a massive boost to our public hospital system. It's exactly what's needed: more staff, more beds, more equipment, so we can do more for those who are sick. This is everything that is required right now. There will be additional announcements of that, I'm certain, but at this stage this is a comprehensive package, a very substantial package of additional money, resources, and indeed resolve to make sure that we've got our health workers with everything they need, doctors and nurses and the whole team across our health system with the resources they need to treat a record number of additional patients in emergency departments, in critical care beds and everything in between. This is exactly what's needed at this time.
Queensland Parliament has fast-tracked sweeping changes in response to coronavirus. Among the measures are fines for anyone who defies orders from Queensland health officials. Here's State Political reporter Alison Horn. Hi Alison, so talk us through the new laws.
Yeah, Ros, so there was an emergency sitting of Parliament late last night to pass through these special coronavirus laws, setting out some pretty strict guidelines for social distancing measures. What the Prime Minister indicated earlier this week, those gatherings of 500 people or more outside or 100 people will be banned. And the Chief Health Officer here in Queensland has been given some pretty extraordinary powers as well to self-isolate people, so to order people, anyone that she deems to be a threat, into a quarantine or into an area. She can shut down areas here in Queensland if need be. And this is really going to have an impact on a lot of people's social lives. So, for example, what we've been hearing is that a lot of bars, pubs, the social scene here in Queensland might be heavily affected because a lot of those places would have capacity for more than 100 people. So the onus is now on the proprietors of those organisations and those places to make sure that those facilities don't have more than 100 people. And if someone was to flout those laws, the Chief Health Officer now does have the power to shut them down.
And are authorities checking up on people to make sure they're self-isolating if they need to, Alison?
Yeah, well, we already know that the Premier has asked Queensland Police to be doing spot checks on people in self-isolation. That's been going already for a couple of weeks now, and we imagine that will continue as more and more people head into self-quarantine, and also as more people with coronavirus are actually being treated at home as well, with the beds in the hospitals filling up. We do know, though, that the fines that were passed through last night as part of these laws will be very extensive, $13,000 for anybody flouting those laws. And the advice from authorities is, why risk it? Why bother to put yourself in this position where either you could be causing harm to yourself or somebody else? So we imagine that there will be pretty strong vigilance into making sure that these laws are followed.
And Queenslanders are meant to go to the polls next weekend for local government elections, aren't they? How's that situation going to be managed?
Yeah, well, if you hear that advice that I was just speaking about, where you can't have gatherings of more than 100 people inside or 500 people outside, and then you think about some of the polling booths that you might see across the state, it does jar a little bit because it doesn't seem to be congruent information. So there have been some emergency measures put in place as part of this legislation. Pre-polling booths are being opened longer, so people can now vote well into the night before that actual polling day. People are being asked to bring their own pens and pencils. Volunteer numbers of parties are being restricted at polling booths, and the how to vote cards are actually being banned as well. But as part of these emergency laws passed through last night, there is also a provision that these elections could be cancelled entirely, which would be an unprecedented situation here in Queensland. Now, the government is keen to point out that they would be in the extreme circumstances. So, for example, if the state were to go into lockdown and this situation were to escalate quite rapidly in Queensland, but those provisions are now in place. At the moment, though, it seems that those elections are still going ahead.
OK, Alison, thank you.